Welcome to Skin to Womb. I'm Dr. Rami, your cosmetic gynecologist and IVF specialist. Today, we're diving into a provocative topic that's generating a lot of buzz: egg freezing. Is it really worth all the hype? Is it the miracle solution for women of all ages? Or does it carry a significant risk of false hopes, especially for those nearing 40? I'm here to break down the facts and dispel the myths surrounding egg freezing. Let's get started. Egg freezing, or oocyte cryopreservation, is a process where a woman's eggs are extracted, frozen, and stored for future use. This can be a great option for those who wish to delay childbearing for personal or medical reasons, such as career planning, health issues, or not yet finding the right partner. The procedure begins with ovarian stimulation, where we use hormonal medications to encourage your ovaries to produce multiple eggs instead of the single egg that normally develops each month. The main medications used are follicle-stimulating hormone, FSH, and luteinizing hormone, LH. These hormones are administered via daily injections for about 10 to 14 days. During this period, you'll have frequent visits to the clinic for blood tests and ultrasound scans to monitor the development of your follicles, which are the fluid-filled sacs where the eggs mature. Once the follicles are large enough, we trigger final maturation of the eggs with an injection of human chorionic gonadotropin, HCG. About 36 hours after this trigger shot, we perform the egg retrieval procedure. This is a minor surgical procedure done under sedation. Using a transvaginal ultrasound probe, a fine needle is inserted through the vaginal wall into the ovaries to aspirate the follicular fluid which contains the eggs. The procedure typically takes around 20 minutes, and most women can return home after half an hour. The collected eggs are then evaluated in the laboratory. Mature eggs are selected for freezing using a process called vitrification. The vitrified eggs are stored in liquid nitrogen until you are ready to use them. Theoretically, eggs can be frozen for an indefinite period of time, although most laboratories will limit it to a certain number of years depending on the country and their policies. The success rate of egg freezing largely depends on the woman's age at the time of freezing. For women under 35, freezing around 10 to 20 eggs generally gives a good chance of one live birth in the future. As a general guideline, the younger you are when you freeze your eggs, the better the quality and quantity of eggs, which translates to higher success rates. However, as a woman ages, both the quality and quantity of her eggs decline. For women over 35, and particularly those close to 40, the situation is more challenging. Women in this age group typically produce fewer eggs per cycle, and the eggs they do produce may have a higher incidence of chromosomal abnormalities, which will not result in a pregnancy. To better understand the chances of having a successful pregnancy from frozen eggs, let's look at this table that illustrates how many eggs you might need to freeze to achieve a certain percentage chance of having a baby based on your age. For instance, a 30-year-old woman who freezes 5 eggs has a 64% chance of having one baby, while freezing 10 eggs increases her chances to 87%. As the woman's age increases, the number of eggs needed for a similar success rate also increases. For example, a 40-year-old woman needs to freeze 25 eggs to have a 60% chance of one live birth. This data highlights the importance of considering age when planning for egg freezing, as younger women have higher success rates with fewer eggs compared to older women. Moreover, younger women produce more eggs per trial. So someone in her 20s or early 30s may produce 15 to 20 eggs in one trial, but as the age approaches 40, she may produce less than 3 eggs per trial. Therefore, it's not uncommon for women above 35 and near 40 to need multiple egg retrieval cycles to accumulate enough eggs to have a reasonable chance of a successful pregnancy. Accumulating over 10 eggs might require undergoing the freezing process multiple times. This can be both physically and financially demanding, and more importantly unhealthy and therefore not doable, and the cumulative success rate may still be lower compared to younger women. Understanding this table can help women make more informed decisions about their reproductive futures and the timing of egg freezing. It's crucial to approach egg freezing with realistic expectations. While egg freezing offers hope, it is not a guarantee, especially for older women. Some providers might offer egg freezing to women close to 40, potentially giving them false hopes. It's important to recognize the challenges and lower success rates in this age group. However, given no other alternative, egg freezing might still be their best option for preserving fertility. Thank you for joining me on Skin to Womb. If you found this video helpful, please give it a thumbs up and subscribe for more informative content. If you have any questions or topics you'd like us to cover in the future, please leave them in the comments below. Remember, your reproductive health is in your hands. Take care and catch us on the next one.